Welcome to Seven Figure Chiro, the podcast that is all about taking your chiropractic practice to new financial heights. We're your hosts, Dr. Jeff and Kristin Berard.
And twice a month, we are here to share the insider strategies, tools, and success stories that will help you scale your chiropractic practice to seven figures and beyond.
Whether you're at the start of your journey as an associate or you're ready to take your practice to the next level, we've got expert interviews, strategies, and inspiring stories from chiropractors who have turned their dreams into a reality.
So get ready to take your chiropractic practice to a new level, and let's crush your vision for success.
Hello and welcome to Seven Figure Chiro Podcast. I'm your host, Jeff Berard, along with Kristin Berard.
Hello.
So today we're going to talk about integrating physical therapy with your chiropractic business. Let's have a discussion about what are the benefits, the pros, the cons, and we'll kind of navigate that a little bit. We've been doing it for many years now, and it has been a huge addition to our business for multiple reasons. So the Chiro PT integration model. We have introduced chiropractic and PT together. The reason why I decided to do it is because there are a lot of my patients that needed physical therapy and or were going to a physical therapist in conjunction to receiving chiropractic care. And there was always, not always, but many times there was this lost communication between what the physical therapist was saying and what I was saying, and it rarely jived. So I decided to bring in physical therapy, and we did that. And the following episode podcast, we'll talk about those specifics. But we brought in physical therapy, and the first thing it did was it added a layer of credibility to our business, because now there was the medical community. We're instantly on their radar more than we were before with, post-surgical cases or pre-surgical cases. And all of a sudden we're starting to see this huge influx of new patients that would otherwise have never come to our office. So that was the biggest thing that we immediately saw was this new layer of credibility that we started to obtain by adding physical therapy. For those of you listening that take insurance, know that every insurance carrier is a little different. Some insurances have, $50 caps. Some insurances, it's adjustment only. Some insurances, you can bill physical medicine codes, but there's restrictions on them. Well, this physical therapy department in our business mitigates all those restrictions. For example, Medicare, right? How many Medicare patients come into your office? All you can bill is a manipulation. And God knows they need way more than a manipulation. So when Medicare patients come to our office, it's a great service now that we can provide them, because not only do they get amazing care from one of the chiropractors and get their spine in check and aligned, but they also get the therapeutic exercises and all the different modalities that they need to, give them the gold standard care and give them the care they need. So we go from collecting, $29 a visit to over $100 a visit just by adding physical therapy. So this is, again, another huge layer where we take a demographic component of our insurance, Medicare, that we would typically recover very little money, and all of a sudden we more than quadruple what we get per patient. And the best part of it all is the patient wins because they get what they need, and the business wins because we get what we think we're worth. So, or maybe not quite what we're worth, but we get a lot more than if we didn't have PT. So that's a big factor. And also looking at some of the major medical, like Blue Cross Blue Shield or Aetna, there's a lot of restrictions to how you can bill those physical medicine codes. We just offload that to the physical therapy department. If a patient is in need of some physical medicine codes, well, we integrate our care with the physical therapist, and our collection rate goes up. We're able not only to acquire new patients into the chiropractic business through PT, but the PT acquires a lot of new patients through the chiropractic. So it's kind of this self-feeding system. And I'm willing to bet that if you're seeing between 125 and 150 people a week, you can nearly double your revenue by adding PT. So if you want to grow, and maybe you already have one associate, or maybe you don't, maybe you want to expand your business, but you don't want another chiropractor because you can facilitate it all by yourself. Well, consider hiring a PT and growing another branch to expand your business, expand your revenue, expand the line of services you offer, expand your credibility in the community, and be a little different. It's amazing the amount of new patients that come to us because we have them both under the same roof. It's just unbelievable. I never expected people to say, well, I came to you because you have both. And we work together, we collaborate together on patients, and it just has been a great adjunct to our business. And the physical therapy department has continued to grow year after year, and it's actually has got to a point where it's growing more so than the chiropractic side. And that only has the potential to help the chiropractic side and help offload a lot of the compliance burden that chiropractors are put under. PTs have a system to bill physical medicine codes that they're not scrutinized as much as chiropractors, and we're still able to deliver the care we need. So that's another great reason to add physical therapy. Obviously, to add physical therapy, it requires navigating some rules and laws and things like that. And I'll just give ourselves a plug here. If you go to sevenfigurechiro.com, just request some information about integrating PT, and we'd be happy to help you. We do that, and we're very proficient at it, and we can help you navigate all those intricacies. It's not difficult to do. You just have to do it right so that you're compliant. And there's just steps you need to take, and we'd be happy to help you navigate that and see those numbers soar, the new patients, the revenue. It's just amazing how many layers it adds on to your chiropractic business.
Yeah, so I would say when we started PT, if you've been listening since the beginning of our podcast, you would know that Jeff had 2 clinics in South Florida. And when we sold our clinics in South Florida and moved to Michigan, we built this 5,500 square foot building, and we only had plans to use half of it. So we were really only using about 2,000 to 2,500 square feet of space. And the other 2,500 square feet of space was going to be rented out to another business. And we had no plans to ever really use that space, but to monetize that space and help our business, essentially. But when we had a PT approach us who really liked our chiropractic model, and we are a sports chiropractic clinic, but it doesn't mean that you have to be a sports chiropractic clinic to integrate PT. There are a lot of other types of PT services and chiropractic services that can work together to be a multidisciplinary clinic. But I will say we didn't grow into that 2,500 square feet right away. So we integrated our PT literally into about 500 to 800 square feet.
Yeah, I think it's about, no, not even. I think it was about 650 square feet. It was room for 2 tables.
Yeah. So you don't have to have a ton of space to integrate PT. One PT can operate in a smaller space. And then as your patient visits and new patients grow, then you can look at expanding. And I tell everyone, no matter in our stretch center business, in our chiropractic, in sports rehab clinics, you want to grow out of something, not have to grow into something, because it makes things a lot more difficult to try and fill the books and try and kind of maneuver all the different things that you're trying to do. So thinking about adding PT, it's not that difficult as far as space is concerned. Now, with the legal logistics, I will mention that there are quite a few legal boundaries that you do have to hop over, and we can help you with that. You will definitely have to reach out to a healthcare attorney, which we can do, and we can help you kind of navigate those specific things, because there are stark laws where you cannot specifically have a patient going from your office right to your PT if you're referring them, unless that patient chooses to see one of your PTs. So if you're coming in and telling a patient that they would benefit from PT, that patient needs to know that they have the autonomy to go wherever they want. But like Jeff mentioned, people love having everything all under one roof because they know that the providers are working together and they're going to get the best care that they need as a patient. And so I would say that if you're trying to navigate and you're thinking about these specific things, multidisciplinary clinics are popping up a lot more across the globe because people need convenience and they want to know that their providers, their doctors are communicating with one another. And if they're having to go from place to place or start with one doctor and finish their plan of care at one doctor and then go to another doctor because maybe something didn't work out, well, it's sometimes a waste of time for some of these people, because if they're working with multiple providers and those multiple providers are communicating with one another, they can divert to a different plan of care if that patient needs. And so I would say that adding PT in your chiropractic business is a great thing. But there are some interesting things that we navigated when we first added PT, right, Jeff? We found that there are a lot of PTs going to school that are maybe learning to kind of get away from chiropractors and not work with chiropractors. So I think that that's a hoop that we had to jump through when trying to find PTs because of the different things that they're teaching in these PT schools. But I mean, there are going to be also a lot of people out there that understand the chiropractic profession and want to work one-on-one with them.
You know, I think there's more PTs out there that would work with you than don't. I don't want Kristin to scare you away from it, because more PTs want to work in an outpatient setting than a hospital. And being able to work in a chiropractic office with young, vibrant people that want to be there, it's much more attractive than working in a hospital. So my experience in interviewing physical therapists is they're embracing working in an environment like that as opposed to a hospital. Of course, there's some physical therapists that are opposed to it, but that hasn't been an issue for us at all. You know, there's been, I guess, some schools that wouldn't allow, you know, some PTs to intern with us because we're a chiropractic clinic, but who cares? Right? That isn't even on the radar. So that's something that it's not difficult to find a PT who's like-minded like you and can embrace your treatment model, and you and the PT feed off each other and communicate in the same language so that the patients feel that collaborative effort. A last thing that I want to mention, when people hear seven-figure chiro, you know, a lot of people want to get to 7 figures because it gives you liberty, it gives you freedom to go do things you want to do, not be imprisoned to the office and whatnot. And that's another large benefit that physical therapy has provided us, is the autonomy to, you know, if your chiro is down a little bit, the PT is likely to be up, right? And if one feeds off the other, and if you want to take a vacation, well, you have this whole other business here that's bringing in revenue that can augment what you're losing when you're not there. So it's a way to free up the shackles of being imprisoned to your office and, you know, having someone else generate income other than you or other than your associate chiropractor. So if you truly want to become a 7-figure chiro and you're not a purist, if you're a purist, this isn't for you. Stick with chiro and don't do anything else. Hire 1 billion chiropractors and go crazy. But your goal isn't to see as many people as possible. If your goal is to provide gold standard care where people get exceptional results through the integration of chiropractic and PT, enhance your credibility in the community, grow your name, grow your reputation, give yourself freedom, I highly encourage you to consider integrating physical therapy with your chiropractic business. And again, I urge you to reach out to 7figurechiro.com. We'd be happy to help you with that, navigate all the intricacies, and get you launched as soon as possible. On our next episode, I'll discuss how we integrate the patients with PT and what that looks like to help you maybe navigate that aspect of it. So I hope we dropped a seed. I hope you find some useful information to perhaps consider integrating physical therapy into your chiropractic business, because I know for certain if you're seeing between 125 to 150 patients a week, you can get your physical therapist going ASAP. You can start generating a new level of revenue, build a buzz in your community, and start bringing in new patients that you haven't seen before. So until next time, Dr. Jeff, keep up the good fight.
Goodbye.
Thanks for tuning in to this episode of 7-Figure Chiro.
We hope you're walking away with some valuable insights to apply to your practice.
Remember, building a 7-figure practice doesn't happen overnight, but with the right strategies and mindset, it's absolutely within your reach.
If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your fellow chiropractors who are on the same path.
And be sure to join us the next episode for more strategies, bring clarity to your vision, and elevate your financial practice to success.
Until then, keep pushing forward and making an impact.